So when looking at providing culturally competent and culturally sensitive care, just be mindful of your tone, your volume when speaking. Don't misinterpret head nods as a sign of comprehension. Oftentimes, head nods are used to show a respect. Eye contact may be avoided. It's not necessarily a sign of disrespect. And speak with typically the older generation Filipinos with needing to accommodate anything such as spiritual guidance or prayer when they're making healthcare decisions. Say excuse me may ask you a question rather than just directly asking a question to show some respect. And use po as a title that pays respect to strangers, new acquaintances, and elders when speaking. As far as health promotion education with smoking cessation, see if they are an active smoker, or and if they are, if they use any nicotine patches, or if they're trying to quit smoking. Give them any smoking cessation resources that you may be able to provide, and help them with quitting smoking if that's an issue for them. As far as if they're sexually active, though it may be a touchy subject to touch or a touchy topic, do the best you can with bringing it up. And if they are sexually active, find out if they currently use any condoms to help prevent the spread of STIs or HIV. And though we oftentimes don't think about it, when doing a med reconciliation, see what teas, herbs, and spices and things of that nature that the client or patient may take to treat any illnesses, ailments, or just on the regular for general health. A lot of times these things can actually, though we don't consider the medications, they can actually interact with the effects of certain medications. For example, St. John's wort, it's thought to be a bit of a natural SSRI. So if a patient is taking antidepressants and they're taking St. John's wort, that could cause some very deleterious effects if it mixes with their medication. Or if they're, say, taking cayenne pepper, a lot of it may affect a blood thinner that they may be using. So it's really good to find out that sort of information. The majority of Filipinos are Catholic, so many of the accommodations that they're going to need aren't going to be unusual to the caregiver, and they shouldn't be too difficult to make. Ask specifically, especially patients and family members of older generations, if they have any special requests, if there's anything that they need, and if it's something that's controversial or sounds like it may go against policy, consult your charge nurse. So an ethical question, an ethical dilemma would be, what if a Filipino woman who's going to give birth at a particular hospital wants to keep the placenta or umbilical cord after the baby is born? This will depend on I believe your state as well as your facility. Some hospitals, their policy may allow the mother to take home the placenta or umbilical cord. However, many of them do require a court order to take it home, because they would consider either as bringing either home as transporting an organ. So find out your policy, speak with your charge nurse, move up the chain of command, and if the hospital is able to make those accommodations, make sure that the patient is seeking to go about it well in advance before they actually deliver at that particular hospital. Because from what I understand, it is a very timely and difficult process. It's not something very common that I believe that people want to do, take home the placenta or umbilical cord, but with what I spoke on earlier about how they believe the child will turn out with certain traditional practices, or they may request to do either of those things, bring either of those home. So if you can't make those accommodations, just be sincere with the patient and ask if there's anything else that you can accommodate or help them with after the birth of the child. But if this is something they request to do, make sure that you're able to help them figure out how to do so well in advance, because I believe it is a lengthy process. Here's some of my references, and thank you.